to an information session for the Housing and Urban Development's fiscal year 2026 Continuum of Care Notice of Funding Opportunity, local competition for the Seattle King County CoC, and this is for bonus funding and new projects. Today is June 12th, 2026. My name is Eli Griffin, and I am the Interim Procurement Manager for KCRHA. I'm going to pass it over to my colleagues really quick so they can introduce themselves, and then we will continue on with the agenda for today. Kelsey, I'll pass it over to you to introduce yourself.
Thanks, Eli. Good afternoon, everyone. Kelsey Beckmeyer. I am the CoC manager with KCRHA. I will send it to Joe.
Thanks, Kelsey. Good afternoon, everybody. My name is Jo Bechtold. I use she, her pronouns, and I'm on our procurement team. I'm a procurement specialist, and I'll pass it off to Shani.
Hi, good afternoon, everyone. My name is Shani Jones. I use she, her pronouns, and I serve as one of the other procurement coordinators on the procurement team. Thank you.
All right, thank you, everybody. So the agenda for today, we are going to go over an overview of the NOFO and timeline for the entire process, then go over HUD CoC priorities, system and geographic gaps. Then we'll go over a timeline specific to the request for proposals, program areas and requirements within the RFPs, funding available, what the application review is, how to apply, and then we will have a Q&A portion for you all. All right, I'm going to hand it over to Kelsey to start this first portion.
Thanks, Eli. So as some of you may be aware, the NOFO, as we call it, is an annual competition to renew CoC funds and apply for new funding opportunities made available by HUD during the NOFO competition. The timeline for this process is very fast. The NOFO was published on June 1st, and it is due to HUD, the entire application, on August 26th. So this is a very fast timeline and fast process that involves a lot of pieces and components. For our local competition, applications for renewing projects and new projects will be due on July 3rd. This allows us to do a review, put together our priority list, and then complete the second part of the NOFO application called the consolidated application. HUD will be awarding CoC bonus funding. This is how it's framed and called. For FY26 for contracts that will begin likely midsummer of 2027 at the earliest. All of this is pending the outcome of our consolidated application and the merit review of that application. So even if a project is accepted to be submitted to HUD in the priority list, it does not guarantee that HUD will award it funding. So again, acceptance on the local competition level does not guarantee that a project will be funded by HUD. All applications also require 25% match from non-CoC fund sources. This is required per HUD rules. Next slide. Want to do a high-level overview of our timeline. Again, HUD released the NOFO on June 1st. Our local rating and ranking process and criteria was approved by the System Performance Committee and CoC Board on June 8th, and the local competition was opened on June 11th. Our aim was the 10th, but we got it up on the 11th. All applications for the local competition will close on July 3rd, 2026. Between July 8th and July 31st, a panel of raters will give a score-based rate to all applications, And on August 3rd through 4th is when a ranking panel will develop the priority list. So which projects will be funded and in what order we would like HUD to prioritize them. On August 5th will be a preliminary review of the priority list with the CoC board. Applicants will be informed by August 10th, and by August 19th to the 22nd, that date's still kind of to be determined. There will be a special CoC board meeting to approve both the consolidated application and the priority list submission to HUD. The submission to HUD is due on August 26, 2026, and HUD has indicated that they plan to make award announcements by December of 2026. Next slide. There are particular priorities that HUD outlines every year in the NOFO. And in FY26, the following are HUD's priorities for the CoC NOFO competition. The first is to improve outcomes. HUD wants to see projects that are promoting self-sufficiency related to employment income, as well as recovery from substance use disorders. HUD is aiming to create greater competition to improve innovation and accountability. Part of this is through what HUD calls Tier 1. Tier 1 are more guaranteed projects to be funded. That level has been set at 60% of what is called the annual renewal demand. This is the total amount that HUD anticipates we will be applying for, or the minimum amount they anticipate we will apply for. 60% of that is more guaranteed, asterisks, if we pass eligibility criteria. And 40% of that will be in a national competition. The aim is for this to really be a results-based approach to reduce homelessness. HUD is aiming to restore greater balance to the continuum of care funding. They are focusing on new projects, primarily transitional housing and supportive services only projects. There is also a focus on treatment and recovery. They are aiming to see that our projects are providing behavioral health care and wraparound services. They want to see promotion of economic self-sufficiency. This includes partnerships with workforce development organizations or systems, with employment or employers, and with child care providers. Their next priority is to advance public safety for all. They are encouraging strong collaboration with law enforcement and other public safety community partners to increase public safety within the community. They are also aiming in this to minimize trauma for vulnerable populations. They want to see projects that are promoting trauma-informed and person-centered practices, particularly for those who are survivors of domestic violence, sexual assault, stalking, or sex trafficking. And finally, they are wanting to expand access based on merit. This is an opportunity that is open to all eligible organizations, inclusive of nonprofits, faith-based organizations, governments, and tribal organizations. To help inform the local competition, KCRHA did a review around system and geographic gaps so that we can prioritize funding for new projects that meet these gaps. KCRHA reviewed a decade of various reports and gap analysis and system analysis to identify overlapping gaps that we've seen in our system over the last decade. A review of this was then put forward to the community in a survey to help narrow down what those focuses should be primarily. Knowing that this is an opportunity that cannot meet all of the system and geographic gaps, but may allow us to have a kind of more narrowed lens around what types of projects we want to put forward to meet the needs in our community. This really came down to kind of 5 holistic areas when it comes to system and geographic gaps. One is that we definitely see that services are inconsistently distributed around regions in King County, with a heavier concentration in Seattle and other shortages primarily in South and North King County, as well as in the Snoqualmie Valley. Another gap is around housing navigation supports. We found that our system really lacks the scale and regional accessibility to housing navigation for all populations, particularly as it comes to those who are experiencing unsheltered homelessness to access housing resources through our coordinated entry system in a efficient way. We've also seen that there is insufficient and mismatched housing and service capacity, that we're missing overall scale and the mix of the right interventions to meet population needs. Thus, we will have a focus on transitional housing, primarily transitional housing for special populations. Those specific subpopulations include families, elders, people exiting incarceration or foster care systems, as well as DV survivors. Finally, we have behavioral health and clinical care gaps. There's a shortage of integrated behavioral health, substance use, and medical services in a variety of housing and crisis programs, especially for high acuity individuals. So something that may be prioritized are transitional or crisis housing that provides these specialized integrated behavioral health and medical supports.
All right, thank you, Kelsey. So the timeline for the new applications as Kelsey mentioned, we released the opportunities on June 11th, 2026, and we are having 2 information sessions, June 12th, which is today at 12 p.m., and then June 16th at 3 o'clock p.m. The last day to submit questions about these opportunities is June 26th at 5 p.m. And then the application deadline is July 3rd by 11:59 p.m. We expect to send out approval and denial notifications the week of August 10th. And then, as Kelsey mentioned, we expect to receive HUD award notifications in December. We also expect contract development for awarded applications to begin Q3 of 2027. So there are 2 RFP opportunities that we are discussing today. There is the CoC bonus, which is for new projects, and then there is the DV bonus, which is for domestic violence new projects, and that includes DV, sexual assault, stalking, and sex trafficking. Wow, excuse me, let me restart. These are the project types that applicants can apply for. For the new project RFP, it is transitional housing, supportive services only, both standalone and street outreach, rapid rehousing, coordinated entry, and HMIS expansion. And that is limited specifically to the designated HMIS lead entity. Then for the DV new projects RFP, that is for transitional housing and rapid rehousing. Kelsey already went over this, but eligible organization types include nonprofit, faith-based government organizations, as well as tribes and tribal organizations throughout King County. The funding available through these processes for the bonus projects, there is up to $5 million available. And then for the domestic violence bonus, there is expected 3 to 5 million. And then we expect there to be reallocated up to $13 million for a total of 18 to 23 million. Please note that HUD hasn't released the final available amounts for the bonus project and DV bonus for us. So these are subject to change. The eligible costs per project type do vary, so I will go across each project type and what the eligible cost buckets are. For transitional housing, eligible costs include leasing, supportive services, operating HMIS, and project administration. For supportive services only, for both types, it is leasing, supportive services, HMIS, and project administration. For rapid rehousing, it is supportive services, rental assistance, HMIS, and project administration. And then for coordinated entry, supportive services, HMIS, and project administration. And finally, for HMIS and project administration. Ineligible costs, these are for all project types, and it includes rehabilitation, new construction, equipment greater than 5,000 per item, capital repairs, and acquisition. All projects must meet minimum eligibility threshold and project quality threshold minimums outlined in the RFP. We will go over an overview of that in just a moment, but please review the RFP in detail. Agencies must meet eligibility requirements and submit the required documents, and then also participate in the Homeless Management Information System, also known as HMIS. All project applications will be reviewed in 4 sections, and that includes due diligence and financial review, a project threshold review, then rating, and then a ranking process. Agencies must submit their minimum eligibility requirements, and I will go over those in just a second, and then a conflict of interest certification and disclosure form, as well as a code of conduct letter, and that is a requirement from HUD. Organizations must also go through a financial review and submit their current fiscal year's financial statements certified by their CFO, finance officer, or board treasurer, and that includes balance sheet, income statement, and statement of cash flows, along with their most recent audit reports with the letter from the auditor, and if applicable, agency plan for correction. They must also submit most recent fiscal year ending Form 990, and then proof of federally approved indirect rate, if applicable. I apologize for this slide deck. I know it can be hard to read, so please review the minimum eligibility requirement checklist. Organizations must submit supporting at least one supporting document based on their organization type. So applicant must be incorporated as a Washington State private nonprofit corporation and provide a certificate of incorporation, or be a federally or Washington State recognized tribe and provide federal or state registry listing, or be a public corporation or other legal entity, and then submit authorizing documents as such as interlocal agreement, legislative act, and so on. And then all organizations must submit the other following documents. So the applicant must be in good standing 12 months before the application and provide certificate of existence. They must have a federal tax ID number or employer identification number and submit the employer identification number confirmation from the IRS. They must have a Washington State business license and, if applicable, a Seattle business license and submit a copy of those licenses. They must not be suspended or debarred and must submit a certification of non-debarment, and then must have an active system for award management registration and an active unique entity ID number, and then submit proof of those. After the due diligence and financial review, there is then a project threshold review. Projects that meet the threshold review will then be moved on to the rater panel. This threshold review includes the requirements that the NOFO has. The NOFO requires that any new project meet both eligibility and project quality thresholds to be funded with CoC funds. So applicants who do not answer yes to project eligibility questions may risk funding eligibility, and then applicants must meet minimum thresholds for the questions in the project type category for which they are applying for. Once applicants are moved to rating, the applicant pool will be reviewed by a rating panel of community members and subject matter experts, and the rating panel will recommend applications to be submitted to HUD for potential funding. Applications will be scored out of a total of 119 points. For addressing system gaps, there is a maximum amount of 10 points. For experience in staffing, there's a maximum amount of 10 points. For partnerships, 11 points. Data and fiscal management, 10. Funding, 25 points. System performance, a maximum amount of 30 points. And then program model and service approaches has a maximum amount of 23 points. There will then be panel-led ranking, where projects are scored and ranked using HUD priorities and local goals. Top priorities are housing outcomes, economic self-sufficiency, and system gaps. Then there is flexibility, so that projects meeting full thresholds may outrank higher scoring ones if they better support system goals, and then system balance, so ensuring there is maintaining of services for those priority populations that Kelsey discussed earlier. Finally, to submit, all applicants must submit application materials via Smartsheet. Please carefully review the RFP to ensure all required attachments are included to ensure you submit a complete application. Applicants must fill out the Smartsheet form, submit a project application form, and that is included on our webpage, and submit a CoC budget template as well. All materials are available listed by bonus and DV bonus RFPs, and those are available on our Funding Opportunities webpage. If you experience any technical issues, please contact rfp@kcrha.org. For more information, please visit our Funding Opportunity webpage. Under all of these materials and information is listed under the Fiscal Year 26 Continuum of Care NOFO tab. Please review this frequently for updates. We will be posting a Q&A document, which will include a link to this slide deck, a link to the YouTube recording once it is posted, and responses to any questions we receive via email or information sessions. And this way, everyone has access to the same information. Additionally, you can email rfp@kcrha to be added to our procurement listserv. Please note you will see this FY26 Continuum of Care tab both on the Funding Opportunities webpage, our CoC webpage, and that tab will be the same across any page that you may visit. With that, we'll finally turn it over to questions. I know we have been receiving some in the chat, so if you have a question, please raise your hand or put it in the chat.
And I'm happy to go over. So there's been a number of questions in the chat that I've been responding to as we go on. So I will just kind of do a summary of what those have been. There was a question around the provision of mental health and SUD services as an eligible program cost. We have this detailed from the local HUD field office. That's included in a Q&A document that will be posted on our website. So please review that closely as it relates to mental health and SUD services provided with CoC funds. I have also posted around definitions of supportive services, a at a glance supportive services that puts what costs are eligible. There are two different things when we talk about supportive services. One is the project type, which I've linked in the chat a deep dive that KCRHA did back in December around various types of projects that can be considered supportive services. And I put in a link around the budget line item support services. There is an at a glance kind of virtual binder from HUD that details eligible costs under that budget line item. There's also been questions around engagement in HMIS. If a project, no matter the project type, is funded in this process, engagement in HMIS and coordinated entry will be required. There's another question around the various opportunities, the CoC bonus and the DV bonus. Programs that are serving those who are fleeing or attempting to flee DV do not have to apply only for DV bonus. It's up to the program to decide which opportunity to apply for. The DV bonus is only available for a program serving 100% of your population to be those fleeing DV, sexual assault, stalking, or sex trafficking. I'm going back through the list. We're going to capture all of these and put them online in that Q&A document. Projects funded under this opportunity must serve those who meet HUD's definition of homeless under Category 1, literal homeless, or Category 4, fleeing or attempting to flee DV. Or if you are serving youth, it may be imminent risk of homelessness. Those have to be clearly detailed. There's a question on how expansions for a currently funded project will be scored. An expansion of a existing project is considered a new application. So it will be scored independent of the renewal, whether or not the expansion will be going forward as a new project. And then a question around the DV bonus. DV bonus, yes, is only for transitional housing or rapid rehousing. It's rapid rehousing, though, for families with children. This is in line with the priority that HUD has set for permanent housing for families with children. At this moment in time, there is no set prioritization of a new project versus a renewal project. Things will be based upon their rating and their performance outcomes, as well as how that project details how they will meet specific system performance measures. There's a question around how HUD defines CoC eligibility for people exiting incarceration. This is a very good question. That is dependent upon, one, the length of time someone was incarcerated, and two, from what circumstance they went into incarceration. If somebody who was experiencing homelessness was then incarcerated and was there for less than 90 days, then yes, they would be considered literally homeless. If someone was experiencing homelessness, was incarcerated for more than 90 days, no, they are not considered to be literally homeless. So it really depends upon their circumstances prior to incarceration and the length of time. If it's 90 days or longer in an institution, including incarceration, that is not considered to be literally homeless. And then a question, is the award of the expansion dependent on the award of the renewal? If a renewal is not put forward in the priority list, an expansion likely would not be as well. When it comes to HUD's review, HUD would likely not fund an expansion if they're not funding the renewal. So in the local competition, there's some dependency. In the HUD review. Yes, definitely dependency there. A question for transitional programs: could we designate just a portion of units so we can still accept women who don't qualify under category 1 or 4? If you want to put forward in an application, say you have an organization that has 25 transitional housing units, you are allowed to seek funding for 10 of those 25 units. You do not have to put forward funding for the entire program, but it can be for a subset of units. And then another question to clarify: does an organization need to currently be using HMIS when the application is submitted, or could they be in training? It is absolutely okay to not currently be accessing HMIS. That will not preclude you from applying in this opportunity. By the time you are granted the award and starting, that is when you would need to be in HMIS and using HMIS. All right, for regarding braided funding, if the org has verified external funding sources, but they are flexible and not specifically tied to housing, stability, or behavioral health services, is the org able to receive credit? If it's tied to the project and the supports in that project, then it may be eligible in the braided funding. The intent of that is to really look at what are all the other funds that are supporting the application you're putting forward. If it's just funding that your organization gets writ large, that's different than the funding for this specific project. So we really want to know about all the other fund sources connected to this specific project you are applying for CoC funding. Another question for transitional programs: what level of documentation is expected for the 20 hours? Oh, it just edited. What level of documentation is expected for the 20 hours of required work/engagement, especially since the RFP says the project description does not create a reporting or documentation requirement? At this moment in time, we do not have further guidance from HUD around what the documentation level is expected to be. If and when we get that information, that will be shared out. At this moment in time, would look at, is your program able to provide those services, likely documented through various forms such as case notes, attestations, or kind of other documentation that you may have. Largely something that's looked at is a once a month case note that can detail those things. But there is not a kind of hard and fast requirement at this moment. Next question: would programs that serve an overlapping population of DZB survivors and families be prioritized over programs that serve one of those populations? At this moment, the questions we are asking around population is around 100% of that population. It's really up to the program how you want to present that in your application. Okay, a note, I believe this might be around the work requirement piece, but just a note from another person in the audience that when HUD asked previously around work requirements with public housing, they did not provide a tracking and reporting mechanism. Largely, this would be done through monitoring. Again, if we get further guidance, we will post that. A question around the priority for permanent housing projects serving families with children. If a project serves both families with children and single young adults, would it be prioritized as a project serving families with children? Again, we'll put that up to you as the applicant around how you want to submit that application regarding the populations that you are working with. That is what we will be reviewing, and we'll put that into your hands. I do see a Q&A that I'm going to pull up. And if folks just don't want to hear me like continuing to monologue, you are welcome to raise your hands. Oh, there is no longer a Q&A. That might have been me making something up.
I believe both of them got answered in the
Oh,
chat. I
beautiful.
see one other chat, 3 up about the 50% metric.
Yes. For this 50% metric, how is that defined? Is it 50% of all enrolled participants or 50% of participants that exit? That metric is about 50% of those who exit the project. So yes, please read those very carefully. These are also metrics set by HUD in the NOFO, so we are using those same metrics in our local competition. And the next part of this was for programs serving disabled participants, older adults, or participants whose primary income pathway is SSDI, rather than earned income, how would those participants be counted? If this is related to the income piece, it's HUD is asking about earned income. For this particular evaluation, it is around earned income. Okay, and then a follow-up around permanent housing for families. A question, they'd like to apply for a project that serves both families with children and single young adults. However, concerned that if our population is combined, it will not satisfy the priority. That would be a decision that you as a program should be making. I want to see how I want to frame this. I'll detail this more in a Q&A question. Any other questions?
All right. I am not seeing. Oh, nope, there is another one. I spoke too soon.
Wondering around if there's any further guidance on requirements currently blocked in the preliminary injunction. We know funding ramifications in the case ultimately decided against CoC. At this moment in time, there is King County v. Turner. This provides a preliminary injunction around specific grant terms. Those things that are included in the FY26 NOFO that are covered by the preliminary injunction are noted in the RFP and the project application. We are moving with that regard. From our stance, those are things that are kind of stricken from the RFP and how it is written, and that's how we are moving at this moment in time. If things change, we will make updates and make that widely available. I do not know what question 19 in the application is off the top of my head. If you could please put that in the chat. Question that if a participant graduates a transitional program and applies for and moves into the same organization's permanent housing program, would that be counted as an exit? Movement to transitional housing to permanent housing, yes, is a exit to permanent housing. Yes. Oh, that's an incomplete sentence, Nicole. We will make sure to get that updated. If this is the CoC bonus application, the full sentence is likely in the DV bonus application, but we will make sure to get that sentence fully grammatically correct. It's likely engages with or coordinates with. Any more questions? if transitional participants pay a program fee, is that an issue? An occupancy fee in a transitional housing program may be charged. It must be based upon income. And there are specific rules that HUD has around occupancy fees for transitional housing programs. We will include that information in the Q&A document. This will be posted early next week.
All right, before we wrap up, I just want to quickly note again, the last day for questions about applications and the RFP process is June 26th by 5 p.m. Any technical questions around issues submitting an application, we can continue to respond to. So if you encounter a glitch after this date, please do let us know. The application deadline is July 3rd by 11:59 p.m. And we do expect to get the slides up beginning of next week. And we will have any typos updated in that were noted updated in the applications and repost that to our web page as well. As mentioned, the Q&A document will be posted there early next week. And then I see we have one more Q&A.
Yep. And it's around joint programs. For this opportunity, HUD is not accepting new applications for joint component projects. Those are projects combining transitional housing and rapid rehousing into one. If an organization is interested in providing both of those types of services, they would need to be separate projects and separate applications, and both would have to participate in coordinated entry, receiving referrals through coordinated entry. Unlike a joint component, you cannot move people between the two, so they would have to be separate projects operating independent of one another. Yes, Hannah.
To follow up on that, so you said no new joint programs, but what about renewals?
Renewals may be handled in a different way. However, I would encourage all applicants who are renewing to review HUD's funding priorities and how your project may or may not align with HUD's funding priorities as outlined in the NOFO. So be very considerate of those funding priorities. This would go for any renewing project. We want to renew as many things as possible and know that the way HUD is structuring the tiers provides some challenges for renewing projects that may fall into tier 2. We will not know what that looks like until the rating process is complete and working on ranking. But we are aiming to renew as many of our projects and put forward a full funding application to HUD. For renewals, we will have a specific renewal workshop next week on June 18th. That is only open to current CoC grantees who have projects that they need to renew. It will not be open to the full public. For transition replacement projects, if the scoring criteria Yes, the performance of the renewing project does impact the transition grant. That is meant to still be evaluating how the program and the organization was performing, knowing that we have that data and that information. For a new project, we may not have information that we can evaluate regarding previous performance and outcomes. Any more questions? If the project was not funded with DV bonus in the past, considered a new project if applying to DV bonus. If a project currently has CoC funding and wants to apply for new DV funding, the entire project would need to be serving DV. The CoC funds and DV bonus cannot combine. If a project that has never received CoC funding is applying for CoC funding, that's a different scenario. We recently, yes, the information I believe was sent out to all current CoC recipients with a link to that meeting. I will also make sure that gets sent out to all current CoC grantees as well to walk through the process for renewals. Any more questions?
All right, I think we are good to go. If anybody has any new questions in the meantime, feel free to email us at KCRH, at rfp@kcrha.org, and we'll have another info session on the 16th at 3 p.m. Thank you all for your time.
Yep. Thank you all, and thank you for all the great questions.